right, I will go ahead and get us started. Thank you, Dr. Popescu and Fordham University Graduate School of Social Services for Social Service for hosting and co-organizing this important event with us, the Center for Migration, Gender, and Justice, Local Approaches to Global Challenges, Migration, Gender, and New York City. My name is Dr. Lara Susan Golosorki. I'm the founder and executive director of the Center for Migration, Gender, and Justice, and we're the initiators of the first Global Gender and Migration Forum, and it's a true honor to welcome you all. Thank you for being here. This is the second day of the forum. We had an opening last night at Columbia University, and we're very excited to have this double header, as I call it, today. First focusing here very locally on New York City, and then talking about gender-based violence in the panel that will follow. At the Center for Migration, Gender, and Justice, we describe our work as locally based and globally engaged. And so I truly look forward to this community talk and would like to again welcome you all near and far to our Zoom participants to the second day of the first Global Gender and Migration Forum. And this is all I will say as the person that is welcoming you all to this space. I'll now pass it to Dr. Popescu for opening remarks. Thank you.
And I'll come to the front because I'm not used to stay so far from people. Welcome, everybody. Thank you for being here today on such a beautiful day in which I am told we are competing with the sunshine. But I promise you, we will win the competition. I'm Marciana Popescu. I'm a professor at Fordham University. More importantly, I'm the co-director of Her Migrant Hub, a beautiful initiative that is community-driven and centered on the voices of women with lived experiences of forced migration. We were supposed to have Dr. Deborah McPhee, the Dean of the Graduate School of Social Service, here with us to welcome you. She is sending her apologies. She had an emergency, so she had to leave, but she wanted to welcome all of you in this space, a space that we are happy to call a community space. So thank you for being here. I want to thank the organizers and to actually thank fate, because I think there is a lot of serendipity that led to this event, you know, starting with Achilles, meeting Lara Susan, and then introducing her to me, and she sharing her idea about this first ever global forum on gender and migration, and we deciding to collaborate all within less than 2 months. And here we are, and you have a week of events that you can participate and engage in, so I'm very happy for that. Why is it important that we have this conversation? Well, let me share with you a few numbers, and of course I need to put my glasses back on. 108.4 million forcibly displaced people currently in the world, of which 29.4 million are refugees, plus an added 5.9 refugees under the direct protection of the United Nations, particularly Palestinian refugees, which sums up to 35.3 million refugees. 62.5 million are internally displaced, which means what? That they have limited to no protection because they are trying to find a safe space within their own countries, the same countries that are persecuting them, or escape the consequences of natural disasters, trying to find new places to live without the needed support. 5.4 million are asylum seekers, and another 5.2 under a newly created category of other people in need of international protection, most of which are Venezuelan migrants outside of their country of origin. Although children are making up 30% of the world's population, 40% of all forcibly displaced people are children. 50% of all forcibly displaced people are women and girls. And I would be amiss not to say that migration is highly gendered. I actually today in my class earlier in the day, I was telling my students that migration is a social determinant of health in itself because it affects lives at so many levels. Well, gender and migration are affecting the lives of so many. In New York City, over 170,000 migrants came to the city since the spring of 2022. Not the same number stayed in New York, but that's a different story, right? Where are they? Where is the migrant population? And today, as we will focus on the local issues, that's a question I want you to keep in your mind. The existing migrant population includes almost half of this existing migrant population is women and children. Women as caregivers, women as essential workers, women at the forefront of our daily lives, yet women in the shadows because they remain invisible. Women leading advocacy events, women shaping the narrative, women pursuing changes, women whose voices we want to center and bring to the front. And this is why we are here today. So as we are sharing stories, as we learn about initiatives, as we are trying to find solutions, I want you to remember that it is the women's voices that need to be centered, and it is their guidance that we need to follow. We have a wonderful panel lined up for us today, so I don't want to take any more time, but just to invite the panelists to the table. And I will give you like a short summary of who they are, so they will know, but there is a whole, summary of biographies in the forefront on the table. So first of all, Marthy Kimde is one of the founders of her Migrant Hub and the current member of our advisory board. She's a woman activist from Burkina Faso, currently living in New York City. She's an amazing activist, and you'll learn from her own journey through a system that wasn't always there for her. And we'll learn from her about her advocacy efforts and the challenges and the resilience that she has and she's willing to share. Second, here we go. Adama Ba. Adama? Is an immigrant rights advocate. She arrived in the US at the age of 2 in 1990. Her life took a dramatic turn at 16 when law enforcement raided her apartment, resulting in her and her father being handcuffed. Deemed illegal, a word we want to stay away from, her father was deported, and though Adama was permitted to stay, she had to leave school to support her family. Today, she shares her story to shed light on the challenges faced by individuals in similar situations. She is an advocate and the founder and executive director of Africana, an organization dedicated to centering Black community services for residents of the Bronx and Harlem. Welcome, Adama. Welcome, Marty. Trina Yonkers-Stotts lived in Central America for over 20 years, working in Jesuit higher education. She and her husband, Kevin, co-founded Santa Clara University Study Abroad program, Casa de la Solidaridad, which integrated faith formation, community living, the accompaniment of people on the margins, and academic excellence. Currently, Trina is the director of the Community Center Outreach and Accompaniment at Our Lady of Mount Carmel Church in the Bronx. She's also pursuing a doctorate in ministry at Fordham University. Trina has a master's degree in theology from Boston College and a master's degree in college student development from Miami University. Very proud mom of 4 amazing daughters. Welcome, Trina. Johanna Miller is a second-year MSW student at Fordham University and the current intern at her Migrant Hub. I would say she's a rising leader in a space that needs leaders and advocates. In her internship role, she is working to expand migrant access to current housing resources and collaborating with migrant activists to advocate for more just housing policies on the city and state level. Welcome, Johanna. Liza Schwartzwald is an attorney, social worker, and trained mediator with a deep dedication to make New York a welcoming city for all families and children. She's one of my favorite women in the world. She's the director of economic justice and family empowerment at the New York Immigration Coalition, where she leads early childhood, 2-generation, and economic justice policy and advocacy work, including directing the Linking Immigrant Families to Early Childhood Education program. Welcome. And last but not least, our moderator, Dr. Achilles Kalergis, He's an assistant professor at the New School for Social Research and the director of the Cities and Migration Project at the Zolberg Institute of Migration and Mobility. His research focuses on urbanization, migration, and mobility in rapidly growing cities. Specifically, it explores environmental mobility and how locally generated data can provide new evidence on mobility patterns and lead to solutions. Welcome, everybody. I promise you this will be a very engaging panel and we'll have a lot to learn from them. Welcome.
Thank you.
So, and I would like to start by thanking Marciana and Lara Suzanne for putting together not only this event, but also a full week of excellent events. And I have to say, as you probably heard in my bio, I'm not a gender migration expert, so I'm here really to learn from the amazing work and experiences that we're going to be hearing. And I would like to start with a question that is addressed to all of you, right? If you can describe a little bit the work that you're doing in the community, particularly focusing on women lived experiences with forced migration. And we can probably start, let's start from Martin, go this way, I guess.
So it's very, talking about this experience is very like emotional for me. I feel like right now, a lot of, like Marciana just said on the statistic, a lot of women are very suffering from the like migrating in here and in this country. First of all, like they, it's so hard, like having a place to sleep, but not being safe. You see, you have to choose. Back home, they have a place to sleep, but they wasn't safe. Their life was in danger. Then they fled to here, then they came here, they are safe, but they don't have a place to sleep. Like it's so hard, especially with women and children. 50% of women, it's so hard. And it's not like the city's not doing it, they're doing it, they're doing their best, they're trying it. It's full everywhere, shelters are full. It's not like when I came here in 2016, shelter wasn't full like now. Now it's like crisis, 100% crisis. And honestly, every single day I always ask myself, how can we do that? How can we do it? Because these people, not solving this issue is gonna turn them to mental issues. So it's affecting them a lot. Being an immigrant, I give my apartment to 5 people for 2 weeks. 5 women that I don't know. 4 people, the 4 of them I know them, but I don't know them. But the 5th one, I know her. For 2 weeks, it was so hard, and they like. For me, the day I have to tell them to go because my lawyer, my lender will keep telling me, "Oh, I can't take them. Like I'm violating the rule. I'm violating the lease." That day we all cry. It was so hard for me with children, so hard. And I feel like what the system is doing right now, sending them to different locations, I feel like it's good, better, best than leaving them here to sleep outside. I feel like it's a good option. But some of them believe that going outside New York City, their life is going to be in danger because what they put on their mind, New York City is the most safe city. So if you can see on the TV, someone arguing, "Oh, we don't want to go outside." Because they put on their mind that if they go outside, they can deport them and send them back to their country. That's why.
Adama?
So I'll start off with my story briefly. So I arrived in Guinea-Conakry at the age of, to the United States at the age of 2. I found that I was undocumented at 16 when my apartment was raided by the FBI, NYPD, and CIA. I became the first female minor to be accused of terrorism after 9/11 in the United States. I spent 6.5 weeks in juvenile detention center, questioned about places and people I did not know about at the age of 16. I was released under certain guidelines, and one of them is wearing an ankle bracelet, which I wore for 2 years. I did not know I was undocumented, so when I found out, I had to take the pathway to become legal in the United States. So I seeked asylum. I was granted asylum in 2007. And if I had returned back to Guinea, I would have been circumcised and forcibly married. My father was ultimately deported, so I had to drop out of high school to support my family. And then I started this work of advocacy. So I've been doing this work for 18 years. And along the way, you meet a lot of women who are suffering, a lot of women who from all over the world. And their stories are, oh, I had to leave because I would have been the R word, or I would have been forcibly married, or my village was this and that. But fast forward to now, a year ago, we got notice that a bus was coming from Texas to New York City. First, it was just a rumor. It became a reality. And that's, by the way, I'll be checking my phone because we actually have buses coming tonight. And I apologize for that. But we greeted the first bus. And when I say we, 5 women were the first ones to greet a bus. When we asked the city to help us, they ignored us. They did not believe us. They did not trust us. We are almost 2 years into this crisis, and the city has not found a solution. They have not tapped into the experts that are sitting at this table, the experts who are in this room. They have not asked us, how can you solve this situation? What they did is, in the beginning, they just welcomed them in, put them in shelter, and said, good luck. No case management, no services, nothing. I can go on forever about what's wrong with the system, but the biggest thing that I want to highlight is how they're trying to divide us, the misinformation that's spreading, who is coming. The conversation about Black migrants are not even spoken about. You have hundreds of Black women that are arriving with children. There's no proper maternal health. I'm wondering why so many women are having C-section. They can give natural birth. These are questions that I'm asking because women are suffering. So thank you.
Hi, good evening. First, I want to thank you for inviting us. It's humbling and inspiring to be up here with all of you. My name is Trina. I approach this from a little bit of a different perspective. I work at a parish, so the work that I do is pastoral. The work that we started was post-pandemic, and it was initially creating a formation program for immigrant Latina women in the Belmont district of the Bronx. So we started off in, I don't remember 2021, I think. And we had sewing classes and we had computer classes. And it was a very simple program. The idea was to build community, and the idea was to build skills for women so that they could have some kind of income generation. So we are now 3 years later, and the program has changed significantly. And from the very beginning, I told the women, so our population is a little bit different. They're women who have, most of them coming from DR, Mexico, Central and South America. Many of them have been here for many years. And so that's not a recent immigration story that they have, but it is an immigration story to be told. And so my only rule when we started the program was, 1, this program is for you. You are not here to fulfill the program. And let's grow together. Let's listen to each other, pay attention. What are people's needs? What are people's gifts and talents? What are the assets that people have? And let's grow together. But from the very beginning, we had 2 ground rules. And Marciana said this at the beginning. One of them is the minute that the women walk in the door, and it's not a sexy place where we are. We're in the basement of a church. We don't even have, I've been working for 4 years with no office, no table. So wherever I am is my office. So the minute the women come in, we say, these are the ground rules. We are all equals here. We are all seen. We are all known, and we are all loved. Because we know the minute we walk on the street, it's different. I've learned since I've come here that there is a hierarchy to immigrations and immigrants in New York City. And so the minute they come in, immigration status doesn't matter. What country women are from doesn't matter. Education level. And from a pastoral perspective, we're not creating some crazy idea. From a Christian perspective, it's the reign of God. Like, we are equals. I think that translates in all sorts of different religions and perspectives. So through the past 3 years, what we started with computer classes and sewing classes has now evolved into 17 different classes that range from guitar classes to cardio to relaxation, parenting classes, mental health. Still the originals. We have within the group of women, we have a volunteer corps. So it's women from the community serving their community. This is how we met, literally on the corner of Belmont and 189th in the Bronx, working at a food distribution. And we're at a really interesting time of transition because the women that we work with life is a scramble. Life is hard, but they are smart and they are savvy and they have something to share and something to teach. And so we're working with Catholic Charities right now on a mentorship program, and we actually have the privilege to work with her immigration hub on a mentorship program as well. So we're in transition with the women of they're recognizing we have a lot of capacities and we have a lot of talent and gifts, and we are ready and we want to share that with people who are coming. So thank you.
Hello, everyone, and thank you for having me. Thank you all for being here. So my role as, a social work student and an intern is really as I see myself as a facilitator. As Marciana said, the sort of the magic of her migrant hub is that it really centers migrant stories, migrant narratives. And I see my role as how do I get these narratives into more rooms? How do I get HMH, which is, a scrappy initiative? I hope you don't mind me saying that, Marciana. Plugging into all of the work that's being done, right? Because I think, I don't remember who said it, but there are so many people doing this work on the ground. There is so much capacity in this room, in this city. One of the roles of social worker, I really think, is to connect those resources, right? And then on the social work side, expanding the idea of what a social worker can be, right? Like having more social workers in the room where policy is being made, right? People who are service providers who actually see the needs and the strengths, I would say, of the people that they work with, and can be in those rooms with policymakers and help expand voices. So I'm just really honored to share this table with y'all.
Joanna also wrote a really great report on housing access, and if you're interested in immigrant eligibility for housing access, it's a great place to look. So I'm Liza Schwartzwald, Director of Economic Justice and Family Empowerment with the New York Immigration Coalition. So the New York Immigration Coalition is a 200+ member and partner organization. We work with direct service organizations all across the state, many of which are in New York City, to fight for immigrant rights. So functionally, we are a policy and advocacy organization with a community outreach branch. So while we don't generally provide direct services ourselves, what we do is really figure out, survey our membership, talk to our partners, figure out what the needs are on the ground, and then we go and we try to fix those problems, right? So we work with the city, we work with the state, we work with the governments, we work with funders, we work with organizations, all together to try to figure out what are actual solutions, and not just small scale solutions, even though small scale solutions are honestly very, very important, particularly right now. But really, how do we change things in a big way? And forgive me if I'm a little scrambled. We've actually gotten, we're in the part of the state budget season right now where the Senate and the Assembly are providing their visions for what we spend our money on, and all of those documents dropped today. So we've been looking through those to see what is the government's vision, right, for immigrants in our communities. And we see our job as enhancing the voice of our immigrant communities. And I think that, all of my colleagues here on this panel have made some really fantastic points about the types of things that we need to look at, right? What are systemic changes that we can fix? Where are we seeing the problems? So one thing that we've been wrestling with recently is, of course, the right to shelter on the New York City level. So something that I've been leading our work on has been responding to the New York City 30 and 60-day shelter restrictions, which are part of what this particular administration is using to get people out of the shelters. And one of the biggest issues with that is that, we may know to some extent who has left the shelters and how many folks have stayed in. What we don't necessarily know is what happens to them afterwards. So we've heard quite a lot of stories about either families who've been moved and had to shift schools or had to drop out of school, or folks who've been removed from shelters or who have left the shelters themselves, really, which means that after their 60-day notice came, they simply realized that they were not going to be facing a great situation trying to get reticketed to get another shelter placement. And so they've simply left the system. That doesn't mean they're not still in New York City, right? It means they are going to informal networks. They are the people that we are seeing on other people's couches or, on street corners or anywhere else. They're simply not on our radar anymore. And what that means is they may not be getting any of the services that we want to make sure that they're getting. Case management, making sure that them and their kids are safe, that they're getting their kids signed up for health care. Right? We know that mothers often come over with children without their spouses, if they have spouses, or without their partners, because that's the way that they, can best, they think maybe they have a better chance, right, of finding a placement, of finding a place to be for their children. They want to send their kids first. And these are all things that we want to address and that we work, as the NYIC to create both legislation, so things like the ICE out bill on the city level, which would prevent the NYPD from doing ICE's job for them, right? We want to make sure that we aren't going, right, the extra mile on behalf of an agency that we disagree with in a very fundamental way. So pieces of legislation like that protect the rights of immigrants, as well as pushing back on policies we don't like, things like the right to shelter restrictions. Councilmember Shahana Hanif has a bill right now in the city to end those restrictions, to say you can't do that. The right to shelter is not a restricted right, and we should, not be kicking any family or any person who needs it out. And then also providing resources. So we're working right now to get funding for legal services for immigrants on the state level. There's a $150 million ask that we have, as well as a piece of legislation called the Access to Representation Act that would guarantee an attorney to any immigrant who is facing deportation proceedings, something that they do not have right now because immigration courts are civil and not criminal courts, which is a thing that many people don't know. So these are all different ways that we work as an organization to look at the big problems and figure out how do we fix it, not just for one or two people, but for all of the sort of asylum seekers or immigrants that are coming through, because this is not going to be a new, a one-time thing. As Marciana said, migration and forced migration are going to continue to happen as we see climate crisis, as we see wars happen. This is going to be a continuing thing. And what we need to do is find systemic solutions so that every time it happens, we know the path forward. And it's a path forward that doesn't hurt the people who are coming here, either by choice or by force.
Excellent. Thank you. So, and we already discussed a little bit about some of the challenges that migrants are facing, but I wanted to ask you a little bit on your perspective about challenges that specifically women asylum seekers are seeing here, right? And Adama, is it Adama or Adama?
Adama.
Adama. Okay. So Adama mentioned that there's buses coming tonight, right?
Yeah.
So can we speak a little bit more about the gender specific, if you want, or questions that have to do with women asylum seekers? What are some of the main challenges that they're facing?
So we see them, so we're at all ports of entry. So we're at the airport, all bus terminals. So fortunately, I'm the first face that they see when they come to New York, but with a big smile. So for women, about 80% of them that we saw are during their journey here. So they did not get any medical treatment. So once they cross over the border, they pass the background check, they pass everything, they are then placed in this bus. And on the bus, they come to New York, and then they admit to us that happened to them. In the beginning, I used to sit with them in the emergency room. I no longer can do that because emotionally was draining to listen to the doctor say that we can't do a report because it happened in another country, but we could give you a treatment for this. But the follow-up was the challenge. The follow-up, because once we put them in the shelter system, we didn't know where they were. They were coming with foreign numbers, and some women would change their numbers when they arrived, and if they didn't take my right number or the wrong digit or language access was the issue, then we could not keep in touch and follow up. So medical is the first challenge. For women that are coming with children, single women with children, childcare is an issue. Childcare is an issue for us, American citizens. For them, it's a challenge too. And one of the biggest one is language access. This Sunday, I met a family that is indigenous from Guatemala. And I don't speak Spanish, so I'm using Google Translate, and she's not understanding me. And in my mind, I was like, oh, she speaks an indigenous language. Thankfully, a friend came to greet her who arrived a couple of months later, who has been in ESL classes, a male. And he was translating between us and just telling me briefly her story and her journey of how she got here. But for a lot of these women, their journeys are hard. They're horrendous, and that story is not often told. So why are they here? Who are they? What are their names? So the language access has become a big issue, especially for Black migrants, because we're not even attempting to ask where they're from. We're not even attempting to understand their language. For example, for right now, Black migrants, the focus has been West Africa, but I'm like, but there's Sudanese women coming. There are Eritrean women coming. And then understanding the cultural needs, the cultural competency, because when we go, the women are not looking at you in the eyes. And they don't understand why, oh, they're lying. No, they're not lying. That's their culture. They do not stare at you in the eyes. And then you have the doctors who are sometimes male, and I'm like, listen, can you get a woman in here? So it's so much as that we have to advocate and educate people on how to deal with this population. We're not even trying at this point. But that's why the people at this table and the people who did this venue together, we need to advocate for them. Because it's easy to take advantage of people who don't know their rights. They don't know. They're coming from countries where their rights were already taken away. And they think that's the same thing in the United States. And then you're like, nope, you're in a new country. Nope, we have to hold them accountable. So, I mean, I can go on forever about the challenges, but these are the main ones. And then clothing. Oh, sorry, I should add on about clothing. The reason why I want to bring up clothing, because I have a lot of women who are heavy set in the upper, in the back. And for some reason, people keep donating small bras. And I'm like, don't they know there are different sizes out there? But undergarments have been such a challenge. Even the hair products has been a challenge. We've been getting lotion, and I'm like, but this is like hand sanitizer. It evaporates in an African woman's skin. We need Vaseline. So it seems like it's the little things. I didn't even know how important nail clippers were until I started welcoming buses. And I'm like, okay, now I have to grab all the 100 nail clippers I have in my house and donate them, because nail clippers are so needed. But it's just the little things and then the big things.
Thank you. Anyone else would like to?
On my perspective, I think for me, from understanding and for what I believe, I think the main issue for these women, including myself, years ago, is first is the housing, like the shelters. Shelter are the primary. Then after that, childcare, because being in this shelter is not as secure. You're not gonna stay there. Like you said, they will kick them out, right? And then after that, it's working permit. Because if they left the shelter, what they're gonna do? They need to work to get to be able to afford their renters. You know, like even sitting and just getting the frozen food, warming the frozen food, eating, it stress you. I went through this. And I used to talk to myself. I used to hold the food, like this microwave is not even working. You have to stay for 30 minutes, sometimes 10 minutes, for the microwave for the food to get to completely become hard. And then you take it upstairs. This was like 1 month, 2 months. I'm sorry, 1 month, 2 weeks, 3 weeks. If you have your own money, these people don't have money, and they're not eligible for food stamp. They're not eligible for cash assistance. So housing, childcare, work, employment card. That's what I believe, what I went through. These three things, if I got these three things at the beginning when I came in, I wouldn't go to a mental issue. I wouldn't get stressed out. They wouldn't leave me in the hospital for 2 months saying that like I have a postpartum depression, this and this and this. What I believe these three is very essential, like very important. And also discrimination. Discrimination inside the shelter, outside. Like she said, inside you feel safe. When you go outside, it's totally different. When they see your look, when they see you open your accent, they know it. They know you're not from here. And it's very, very affecting these women. A lot. I used to cry every single day. I used to even be scared to go outside. Caseworker who's supposed to be my protective, who's supposed to help me, telling me, oh, you can't have a house here, you can't have an apartment, you don't have paper, you have to go out. You have to go out. You cannot. Every single day she keep telling me this. And I couldn't take it. I have to call DSS and let them know that this specific caseworker been, like she's going beyond, like she's doing, like I can't take her anymore. She's telling me that I can have an apartment, I can stay in this shelter. Like she will, in the same shelter, She will put me in this room, to next month, this room, next month, this room, moving me around in the same shelter. Discrimination.
Thank you, Marte. And Marte, may I ask you kind of relatively quickly, because I know your story, but I think a lot of people here don't know the trajectory you had. Can you briefly describe a little bit you described moments in this, but your trajectory coming here?
So I came here in 2016. 2016, my husband was in the army, and he was following the president. So when the coup d'etat happened and the president left the country, so whoever who was working with him, he didn't care. He left them, and then we have to flee the country. So I was 9 months pregnant. I was supposed to give birth on January 19. And I left my country on January 28th. And my water was broken.
Mm-hmm.
I was bleeding. I hide it. I cannot, if I give birth there, me and the child and even the dad, I'm not going to sit here today to talk about it. Maybe it's going to be on the heaven. So, and I take this courage. To take this courage was so hard for me. Very, very hard. And to the point that I didn't even tell my own dad and my mom that I was leaving the country with my husband. So, because he already went to, when he was in the army, he went to UN mission. So he have a fingerprint on the airport. He cannot take the airport. He cannot take the flight from my country. They will catch him there. We have to pass through Ghana. I did 9 hours, sit in the car, bleeding, into Accra, and then from there, when we get there, we get delayed. And we were told we have to add money to get the next flight because I didn't respect the time. So, and when we was about to go, and like the next day, but I have to sleep in the airport eventually, not because you don't know who know you outside. Burkina Faso people a lot go to Ghana too. He was very, very scared. And then when we take the flight, before the last checkup, the lady say, like, I feel like there was a blood, and she said, look at it, she's speaking Ghana language, do like this, and I say, oh my God, they're gonna stop me here. It was me. She asked me, I said, no, it wasn't me. So we went inside, and the blanket, the blanket that you get on the flight, that was my that was the one I'm protecting myself. So I would take his and cover my blood. When it's full, he take it to the bathroom, he wash it, and then I take mine. That's why we did it into Istanbul. From there, and I was praying God to just get here, arrive in this country. Because before we even come here, I do research, and Google told me that as soon as you put your feet in New York City and United States, you are safe. No one cannot take you back. You are very safe. Like your country people cannot come and take you back. No. So my prayer was to just get here. So we get here. As soon as we come out to the flight, there was a police officer sitting right, just to take your passport and put that stamp, right? So I went to her and I said, listen, I'm bleeding right now. I am bleeding, the baby want to come. And I feel like something heavy was coming under me. So he's like, and my accent was so thick. He looked at me, and then he started calling, like take the radio, calling people. And then at like couple minutes, yes, and the ambulance came. I didn't know how I managed to even get to that ambulance. I didn't even know. So I get to the Queen's Hospital. Because the water was broken a long time, the cord and umbilical went to the baby 3 times. So baby want to come, baby, can I come? And I'm feeling pain through my umbilical? Belly button. Belly button, yes. I was feeling the pain over there. So we went to the hospital, and then they said, oh, we have to do C-section. I said, no, I'm not going to do C-section. Because for my belief, C-section is a bad thing. If you do C-section, you become disabled. If you do C-section, like who's going to shower me? This man don't know anything. Who's going to take care of the baby? So you see, with the fake belief that I have, I was going to kill myself. I said, no, these people do their best. Doctors came on me. They did everything to make me like accept to do the C-section. I said, no. I hold that baby like this. And I stayed there, and then I said, okay, I'm fine. The baby's not coming anymore. They said, we cannot release you. We cannot leave you. And then I said, I have to leave. I have to leave. So, and I talked with this caseworker, right? And she said, okay, we're going to give you a shelter. Don't worry. We're going to send you to PATH. Don't worry. If you don't, we're going to wait to see. If you don't give birth, if you want it, we can make a referral, so we'll send you to PATH. So when I get there, get the PATH, before I even get the PATH, I gave birth. But it was so hard. It was so hard because they have to, like, I don't know, women know, like, add me, put their hand, turn the baby head, like, to take the umbilical before the baby was able to come out. Mm-hmm. And after I gave birth, I couldn't talk, I couldn't do anything, and they have to put me IV until I did like 24 hours before I see the baby. So when I see the baby, I was so happy because baby was alive. It was so hard for me, but at the same time, I was happy because for me, I know here my life was saved. I was crying, but I was happy at the same time. And then after that, I give birth on Friday. Saturday, they released me. I didn't even have the money to get the car seat. I don't know what to do. My neighbor, her husband, is the one who buy me the car seat. And we went to PATH. Same Sunday, I was relieved at around 11. I went to PATH with the baby. And then they sent us to Staten Island, Staten Island. Yes, I didn't even know. That day, that was the first time I saw my husband crying. Because the bus was keep going. For him, he think I was taking him back home. I was understanding the language that I was talking, but anytime I'm telling him, he don't believe me. He say, oh, they put me medication in the hospital, and they, I become drowsy. I don't know what's going on. And this is how we get to Staten Island for 10 days. They say we're not eligible. Honestly, on that shelter, I get help. I get a jacket, baby clothing, diapers. They were so very helpful. I'm not gonna, honestly, I will be grateful. They helped me. 10 days later, I was ineligible. I wasn't eligible. They had to go back to PATH again. I went back to PATH. They sent me to Queens. This is the shelter that my worst life started. They stopped telling me, when I came back, they give me a room with the roaches. No kitchen, no nothing. But I don't even mind if I don't even have the kitchen. I put the baby bottle, the roaches is on the top dancing. Like baby, even on the crib, and I went to talk to them. I say, can you please do something so the baby, because of the baby, I don't mind about myself, but the baby, they say, if I don't like it, I can go out. That's what a case worker who's supposed to be my protective, she's telling me that if I don't like it, I can go out. And after that, I struggled over there for 2 months, and then I called. I was outside and I saw a number. It said, if you live in the shelter and you have a complaint, you've been complaining and you still not get resolved, please call this number. I think it was a DHS, something like that. So I called the number, I explained them my situation, and they came in and they sit in the room the same day. They say, I have to leave the shelter. This is how I get referral, and then they send me to Queens Boulevard. And then I went there 2 years. I stayed in that shelter for 2 years. After that shelter, I gave birth to my second child, and we was sent it to Marathon on Broadway. And over there, I did it 2 years. And after that shelter, and then they told me that I can have an apartment and this and this and that. But thank God, I found out the program Housing Connect, which I went to create my own account. And this is how I get my apartment to move out in the shelter.
Thank you, Marte. And the reason why I wanted Marte to tell her story, and I'm sorry that I had to put you through all the memories, is that I think it vividly describes a lot of the challenges that we're talking about and the complexity and the odyssey that particularly women migrants have to go through in order to arrive here in the city. But one of the main issues that Marta mentioned was also the question of shelter and housing, right? So I wanted to ask Johanna, since Liza, she did a good plug earlier on with the reports, right? So I wanted to ask you a little bit about the sort of housing policies that we see that are there to protect migrants, help them find shelter. I'm not talking simply about the right to shelter. I'm thinking of beyond shelter. Is there something there, and what is this? And then if you can provide a sort of a quick a way to understand what is a way to access housing. A main question, and not, I grew up as a housing expert in some ways, is how do people access housing? We don't really understand yet the story, and it's very hard to design policies that respond to people's needs.
Thank you for the question. So the bad news.
Thank you. You want mine? Yes. What can I feel? The word?
Go ahead, Sean.
Thank you, Achilles. Yeah, so the bad news is essentially there really isn't housing policy that addresses new arrivals. So Marty said, kind of beautifully illustrated that yeah, you need housing when you arrive, right? We know that housing is a serious social determinant of health. We know that housing can exacerbate all other kinds of issues. It's really hard to get a job. It's really hard to access healthcare. All of these things without a permanent address. So new arrivals coming to New York are facing the same housing affordability crisis that the rest of New York is facing without the social housing policies that help mitigate and alleviate some of that burden for lower income families. So we are, I think, at a 1.4 vacancy rate for units that are under $1,500 and under in New York right now. And migrants, for the most part, with some few exceptions, asylum seekers are not eligible to access Section 8, to access public housing, to access the housing choice voucher, so the Section 8 voucher, to access city FEPS. Without a legal status, without asylee, refugee, permanent lawful resident, and a couple of other statuses, you are really left to your own devices in order to find housing. And Liza brought up a really great point earlier, that we know that people who enter the shelter system, when they leave, usually there is some kind of recording. Okay, how did they exit the shelter? Did they exit successfully? Where are they placed? And we know that families who exit the shelter system with a long-term housing subsidy get a 1% return rate. So we know that these things work. We don't have that information for this population. They are leaving, and we do not know how they are getting housing, where they're getting housing. Are they still in New York? We have anecdotal evidence, from as service providers, as people with lived experience, but we don't have that census level data. So that's one thing that I think, in addition to policy, is like information, right? Because there are informal networks. People are somehow managing without any subsidies, without any intervention on federal, state, or municipal level. So I think I just want to highlight that is an opportunity for some really amazing participatory action research to happen, right? Where we're not just finding out this data, but we're using that data to then connect people to these informal networks. So that's sort of the bad news. There are some glimmers of good news. The right to shelter, although it is being seriously undermined right now, does still stand. So when you arrive in New York, you are allowed to seek shelter. Adams has currently put a bid in the court to try to dismantle, or I'm not sure the verbiage. That has not gone through yet. So people still do have the right to seek shelter. Governor Hochul there is a new program, the Migrant Relocation Assistance Program, which although the program itself is not robustly successful, I think at least indicates that this is something that is on lawmakers' minds, right? That this is now getting attention. So that program is available. It's not an open enrollment. It's something that you are chosen with, and you have to have already submitted your asylum application. But you don't need asylee status, right? So that's a relative rarity in housing subsidy programs. And then there are people doing work to expand this. I know that Liza, and I'm assuming other people on this panel are part of a coalition that is pushing to get a housing access voucher program passed. This would be a statewide bill similar to CityFAPS or the Section 8 voucher, which would be open to people regardless of immigration status. So there is work that is being done. There is a recognition that this is a serious need that isn't being addressed. My final glimmer of hope is something that Marty brought up, Housing Connect, which is the portal in which the New York City housing lottery, the way of accessing it, is technically open to people regardless of immigration status. However, there are some serious sort of paperwork hurdles in order to access that. And that is something that we, as service providers, as social workers, as people working in this field, can absolutely work on right now in terms of expanding access to that, right? Of like preparing immigrant populations to get this paperwork together, prepare their applications. So there's work to be done. There's people that are aware of this work, but it can feel a little bleak.
Yeah, and you know, I know we're gonna be the one who brings everyone down, but also the reality is that the Housing Connect program is a lottery program. So if you try to do social policy through lottery, it doesn't really work very well because a few lucky ones get the units, but most people don't, right? But you know, in order to try and be a little bit more optimistic, I want to think, and I want to ask you a question starting with Adama, because you said you're one of the first people who received those buses that came in New York, right? And it's almost 2 years now. Have you seen any changes? Is anything that is going better in terms of the reception? Or what are some of the things, what are some of the glimmer of hope that you can see in this past 2 years trajectory? It's a tough question.
It is a tough question. I mean, the mayor made it harder. So he passed this executive order saying that the bus they cannot drop off at Port Authority anymore. Everything that he was asking the bus company to do was already doing it. So it didn't make sense. So you're asking them to give you a 34-hour notice. They were doing that. You were asking them to give you a manifest. They weren't giving the names of the people that were there. They were giving you a breakdown. There are males, there's families, there's children. But the city wanted like an intake data. Like, I want everyone's name there. I want their date of birth. And Texas was like, that's illegal. Like, we don't do illegal stuff. But so this mayor has made this very challenging, the welcoming. So whenever we greet migrants, we say welcome with dignity, because everyone is like, we don't want them here. But you don't know their story. You just heard a powerful story right now. This is just one of many that are coming. So the challenge has been to welcome, and so now we have to greet them at Penn Station. The airport is the challenge. The city has not given us any funding for transportation. So we have to ask donors, we have to ask friends for money for transportation to get them from point A to point B, just to make sure that traffickers aren't picking them up. Because the reality is they are being picked up by traffickers. They're at Port Authority. When we were stationed out there, we witnessed plenty of times trafficker approaching women, and we would ask them, "Perate, do you know this person?" I would get on I don't know a lot of Spanish, but I can be tough and perate. But I would be like, "Do you know that man?" And they would tell me, "No, but he told me he can help me." Where did you meet him? There are countless of women that went with men that I've never saw after that. And I would give them my number. I said, if you were ever in danger, just come back to Port Authority. We will be here. What does the mayor do? He shuts down Port Authority. But there was no safe place for migrant women to go to report their abuse, because their abusers were using the system to abuse them. You have to remember, they don't know the laws. They don't know how the system works. So women are being trafficked. Women, the 60 and 30 days, we're seeing a lot of women stay with their abusers. because they're going to get kicked out of their homes. The 30-day and 60-day, I cannot press to you how horrific it is. So for a family, let's say Stewart. Stewart is in downtown Manhattan near Penn Station. If you get kicked out, you got to take all your luggages, get on a bus with a MetroCard with all your luggage and your kids, go to Roosevelt Hotel, stay there for several days, maybe 2 days, 3 days. Most of the families we've seen 3 days. Get a 28-day shelter. After the 28-day, you get kicked out again. You go back to Roosevelt and you repeat this cycle every 60 days. Does that make sense? I'm like, you can make this all make sense. But the reality is this is a challenge. But the hope is this table here. The hope is the people in the room, because we're going to tell you what the challenge is. And we're going to figure out world peace. We're going to figure out the shelter system, housing crisis. We're going to figure it all out. But the thing is, you can't stay silent. You have to say the policies don't make sense. The mayor is using this rhetoric of we don't have money, the migrants are crimes, this, that. It's all fake. We have about 500 people a day at our office, every single day, asking for help, asking for support, asking for work. How can we work? How can we do this? How can I get into school? And they're met with so many barriers. So tonight when I see a bus, I'm gonna greet them with the best smile I have. But then I feel bad because once they leave my hands, I know they're gonna go into a horrible shelter system where they're asked, why are you here? Who brought you here? Can you leave? Literally, the city is giving them, oh, you want to go to Texas or you want to go to California? Just offering them tickets to random places. So we're sending people to Philadelphia. They get stranded in Philadelphia. We literally have to call our partners and say, listen, the city just re-ticketed somebody in this station. I don't know. There are migrants here are asking go to other states. And I'm like, especially the women. I'm like, do you know anyone there? What are your plans? Who do you know there? These questions aren't being asked. And women are being so impacted, and the children are being moved around so many times. So this school, 60 days, this school, next day. It's really a challenge. The mental health, I can't even touch on it, because how do you even touch mental health if you don't have a secure housing? Mm-hmm. How can you touch on mental health if you don't have proper food? But the hope is here.
I'm so sorry. I have a question for Adamo. I have a question. So when they relocate them, when they give them the ticket, let's say if they send them to Texas, are they sending them to a straight shelter, or just just go to Texas? Make sure we don't know where you're going, just go to Texas.
Just go to Texas. No plan, not connecting them with anything. So in the beginning, we were doing reticketing, we were doing resettlement. I'm a former asylum seeker. I know what I went through the whole system. I'm an American citizen now. It took me 16 years. So I can tell you how this immigration system works. But I'm not the only one doing this work. There are thousands of immigrant rights advocates. Immigration is not just a New York thing. It's a global thing. We're connected with people in Europe. We've even had people in Europe like, you guys are a mess. And I'm like, you're talking? But when we were connecting them to NGOs on the ground, houses of worship, and saying, listen, this person wants to go to Philadelphia because they heard his work. We would make sure that they were in safe hands, not in traffickers' hands. Because the reality is there's so many trafficking that's happening now. But the city just sends them with no plans. And then they say, we reticketed 60% of people. Yeah, but where did you send them? You can't track them after that. So there is this number of a lot of people leave them, but where do they go? The city doesn't know. No one knows.
Wow. There's any way we can just sit with the mayor face to face?
Good luck. We sat with him. Good luck. He praised himself.
Okay, if the mayor is not working, we can go to the top. If we can sit face to face, and some people don't see the reality.
You gotta go.
Yes, yeah, I see it.
Well, I can bring maybe a little bit of hope back into the room. Yeah. So yeah, a few things. So one is, and I love that you said the bit about like, we don't have the money. We have the money. The state last year had a $2.2 billion surplus. With the $500 million that they've added to migrant spending this year, that was surplus from last year. That wasn't taken from the rainy day fund, right? The city had $3.3 billion more than they thought they had, something the city council has been saying for quite some time now, and that the mayor has been giving, very, very different numbers than almost every other organization, including places like the Independent Budget Office that are neutral parties that simply look at budgets and tell you what you've got. But I will say, today, the housing voucher program that Johanna talked about, the housing access voucher program, it is in both fund houses at $250 million. These are all ongoing pieces. These are things we can fight for right now. And Marciana knows she never gets me without calls to action because that's my thing. But there are other things too. And Martine, I was thinking about your story because I think 2 years ago now, we worked on the Coverage for All campaign, which was, working to make sure that undocumented immigrants had access to healthcare. And while we didn't win the whole thing, in addition to winning the essential plan for undocumented adults over the age of 65, we also won a full year after maternity. So it used to be 6 weeks. So you'd get 6 weeks of medical coverage, after which you are no longer covered by insurance. That's a year now. And that's a year now because people like you speak up. And they say, this is what we need. This is what New York stands for. Childcare. New York City, right now, 2 years ago, we passed the first of its type in our whole state childcare program for undocumented immigrants. So $10 million 2 years ago. Last year, we won 16. This year, we're going for 20. What this does is it provides a childcare voucher the same way that an ACS voucher would work for a citizen or for what we call, and Johanna went through this earlier, a qualified immigrant. That program, the only things that you need to be eligible are saying, signing something basically saying, I don't make enough money to pay for childcare myself, and I'm not eligible for other forms of childcare. And I want to give ACS credit here. They understood what their reputation was with, many of the communities that they work with. They understood they needed to be as hands-off about this as they possibly could be. And they said, we're going to go to trusted community-based organizations, places like the Northern Manhattan Improvement Corporation, Chinese American Planning Council, the Center for Family Life, and I think La Comena in Staten Island. And those folks are the places that people go to sign up for that program. They never have to speak to a person from ACS. ACS does not get their data. They get helped by a community-based organization that works directly with their child care provider to make sure that provider gets paid. We have solutions. We can build more solutions. And I think in the horror of hearing people's stories, the ways that these things have gone wrong, we can turn and we can say, this is a democracy that we're living in. This is our money that we're putting into, our taxes. This is our work that we're doing. We have the right to demand from the city, from the state, programs that are reflective of the needs of people in this state. And when you are looking at 40% of New York City being immigrants, then that means that your programs have to reflect those needs. And so I want to just remind us that the people working here are doing phenomenal work. And there are organizations all across the city, all across the state, all across the country that are doing that too. But it means making sure that your voice is heard. It means calling your electeds every time something comes up, harass them, really do not let them forget that you are their voters and that your voice matters, because folks who come in here and they can't vote, right? And they're coming in here looking for help. Those are the people that we need to represent, that we need to raise our voices to amplify their voices, right? It's not our job to speak for them. It's our job to amplify them and to make sure that we are creating systems that meet the needs so that we walk down the street and we don't see people on the street corner because we aren't giving them what they need. We don't have people who can't get affordable housing or a housing voucher to get out of a shelter. When a family has a voucher to get out of a shelter, there is a substantial drop in their likelihood that they ever end up back there. And that's not the case when you don't have those. So we can, we have solutions. They're not perfect solutions. They're never going to be perfect solutions. But a good solution is better than not trying. It's better than not acting. And it's better than saying, oh, sorry, it's somebody else's problem. It's our problem. This is all our problem. It's a shared problem. And it's a problem, I think, for us as women. I think, we've got this whole panel of women here representing women all across the country, all across the world, who are coming and trying to find safe places to be and, systems that are going to help them. And so I think listening to the voices, listening to the stories, and then meeting with our experts, meeting with our policy experts and our electeds, and making sure that we're telling those stories and providing alternatives is, I think, what I wanted to make sure that we got to today.
I just wanted to add another piece in terms of the financials, it is way more expensive to shelter someone for a night than it is to provide a stable, permanent home, both in upfront costs of like actual what it costs to shelter over a night and downstream costs in terms of healthcare, access to the criminal justice system, access to child welfare system. The report that came out along with this housing access voucher program found that it would save the state $1 billion with a B dollars over the course of 5 years. So not only do we have the money, it would save us money.
Yeah, I agree with what she's just said. I remember when before I even moved to my apartment, my caseworker said, "Why they don't want to give you a voucher? Because you know how much you pay here? $3,000 a month, and then my apartment was just $1,500. Like she said, if they give me an apartment, they're going to save the half of the money they're paying it.
Yeah.
Shelter costs a lot, double expensive than when you're going to take an apartment."
So can I ask one question also, Trina, because I want to hear from your experience with the Grupo de Mujeres Latinas, right? We heard a little bit, Liza, kind of the advocacy work up on the top, but I want to hear a little bit more also what is happening at the grassroots level, what is happening, what are the lessons learned? Because I think
yes,
it's a lot.
Absolutely. And I think Adam and I started talking about this about 6 months ago, because I think in talking about glimmers of hope, and I'm very aware that the population with whom I'm with is very different than the population we've been talking about, the recent arrivals. And so in some ways it's a different conversation, and it's a different, the same goals, right? And I think is talking about hope. And I do believe that the work that we're doing in the Bronx and the Belmont district is a glimmer of hope, not only for the women who are directly a part of that program, but also imagining how can these women come together and imagine and find pipelines for how can they become those who accompany, who become advocates, who become mentors for somebody who shares the same story. And so it's a really exciting time for us. It's the first time that we'll ever be doing it with Catholic Charities. And we're starting next Tuesday a mentorship program. So we have 25 women in our program in GML and 20 newly arrived asylum seekers who will be gathering together. It's going to be catered. They're getting a gift certificate. And even before we started that, we had like a heart brainstorming session with the women and said, do you remember when you came? What did you need? And so we spent, and Marciana was there. I think it was the first day that we met, right? And the women talked for 2 hours about what they wished that they had had. And I guarantee you, over half of the women, and some of them have been in the States for 15 years, so it's not as fresh as some stories, over half the women wept. And a lot of them said, somebody who could accompany me and somebody who could just tell me the truth. So I think for us, and I think that's why I was invited here today, is this is a model of something that we're doing in the Bronx and something that works and something that can be replicated in different communities with different populations. And I wanted to share with you, because I had a little bit of a family crisis this last week, and this morning I was like, oh, right, so it's tonight. So, and I happened to be in the sewing class with the women in the basement of Fatima Hall. And I said, hey, I've been invited on this panel. And what has the experience been like for all of you being part of this GML program? So I just wanted to share a few, and it's always so much more beautiful in Spanish. It's just a fact. Yeah. So this woman is from, so I'm just going to share with you impacts for her of GML. And I also want to share, I mean, the population with whom I work is more Latinas, more from Central South America, who the culture, where they're coming from, community and family is the foundation. It is as important as the water they drink and the food that they eat, right? And so even for women who've been in New York for 10, 15 years, a lot of them, until they came to GML, there was, and I'll share one woman, Jenny, who's been here for 15 years. She works in the kitchen somewhere in Manhattan. And when she first started with the program, she was part of the first group. She would literally, there's like a pillar like this in Fatima Hall, and we would always have a break for coffee and some kind of pan dulce, something. And she would hide behind that pillar and eat, avoiding people. Yeah. 3 years later, we have a cardio class that we do, and it's just a blast. We jam music, and it's just fun. And she corrects me. She's like, Trina, that's not how you do it. This is how we need to do it. You forgot to stretch. I mean, this woman in 3 years has found a home. She has found a community, and she has found her voice, And so let me share with you. So this woman is from Chile. She says, my experience has been marvelous. From never talking in a group, now people have to tell me to be quiet. I have learned how to interact with other women. My depression has lessened, and my self-confidence has grown. I learned to embroider, sew on a machine, and much more. I feel so blessed to be part of this program. Another woman from Mexico. My experience with GML has been marvelous. I came at a moment when I really needed support, and I found it. The activities not only helped me feel better emotionally, but also physically and spiritually. And this, I think, is really important. I am encouraged personally, which impacts my family and it impacts my work. I feel I am at the right place with the right people. I'm gonna share two more because they're just too good not to share, right? I had like 25. I was like, how do you pick? And I've got them all here in Spanish if somebody wants to see all the other ones. I am so grateful to GML for the possibility to do healthy things and engage again with the world. This is a place where I am living and reclaiming my life after an experience that for many years kept me isolated. We also work with Fordham University. We have Fordham students that are part of our program, and we're very clear when we have people come in. We don't use the word volunteering. We don't use the word, what's the other words that people use that make my skin crawl?
Interning.
Or something like, I am coming from the university to fix the problems for you. No. The students who come to a company, and they come as students. They come to learn. They come to a company. They come to listen to stories. So they're in the sewing classes. They're in the cardio classes. They're in the guitar classes together. But they are learning alongside the women who are in the program. And even with that, there is no hierarchy. Probably there is a hierarchy. The women have a little bit more power. But and so she shared too, and so I think it's important because this is a collective response, right? If we're going to do this, it is a collective response from the community. She said, my experience with GML has been overwhelmingly positive. I enjoy every program I'm a part of and the additional community activities we've done. Everyone is incredibly kind and values the GML community, make everyone feel open and welcome to a wide diversity of women. The community has also been very responsive to the needs and wants of its members. So she even said, in a cardio class, we always adapt the exercises. I think I asked this question today. We had a cardio class yesterday. So, but just to say, and I think that's why I was invited to say, this is a glimmer of hope. If we can connect these communities of women who are in these, wherever their spaces are. For us, it's at a parish, but these women are ready. And they are smart, and they are feisty, and they are fighters, and they do know their rights. Life is a scramble. It is really hard, but they know. And so how can we make these connects with other populations that have lived that, and they know what they wish they would have had? So did I answer your question? Okay, yeah.
Can I add on? So the GML women support me at the food pantry in Nebraska. That I don't have to go anymore. We've been together for now, 3 years, 4 years? Mm-hmm. These women are strong. They are powerful. But it's the sisterhood. It's the fact that a woman like me who opened up a food pantry in a mosque and a woman that are coming from the church helping me. And at first, I remember telling Trina when I opened up the food pantry, people were like, are you trying to feed us or convert us? I'm like, no, I'm trying to feed you. Just come on in the mosque, get food. And then she comes one day, she starts sending these amazing women to help. This is what the hope is. We've now created a coalition of interfaith. Now we have a dialogue going. Now that other women who won't be in the street because they know they can go to Trina. And that model, we're trying to replicate it to everywhere. So thank you.
Please. And maybe just to share, because I think there's some, and I think, and when I actually first started, I laugh every day that I'm working in a parish, because if you knew my backstory, it's quite ironic. But I think when we first started, everybody who was in our program was from the parish. There were people who you would just figure, the regular cast of characters who do everything. They're like, oh yeah, I'll do it. And now 4 years in, I would say the majority of women are not from our parish. And I think that is a great indicator of success. That they're not, and we're very clear on there is no agenda other than creating a safe space and a communal space where we can grow and learn together. So I think that that's a really important, if we're thinking about this kind of thing, it can't be conditional, right, on what we believe or we pray to, or if we pray, but that it is our humanity that binds us, and that we are each other's keepers, right? We are.
Kind of like, now, what is your strategy? Spread this work, got all of us working doing. Are you bringing legislators and policymakers in to see your program and hearing it firsthand?
Well, I'm sitting here and I'm like, I'm not a policymaker or an advocate, but I have now all these women who are, and I think that, we all play a different role in this, and how can we get more visibility? I think it's really important. Marciana and I are talking about, like, we have anecdotal things that we know this is making a difference in women's lives. Have we done any kind of quantitative, qualitative research on it? I do evaluations multiple times. I think that's why it's so successful, it is not a fixed program that we have. And I tell women almost daily, you are not here for the program. The program is here for you. These are the two negotiables and what I shared with you earlier. Other than that, let's be creative. Let's dream.
A strategic plan. Do what you're doing now. Bring in the people who can make things happen.
Thank you so much. I love that. And also, we need a channel. We need a TV. We need a TV. I'm telling you, we need a TV. Broadcast, yes, you got it. We need that. We need that.
I know for me, the city looks at me as an advocate, but that's my job. I have to hold you accountable. And so they're afraid of advocates. Because we call them out. I don't care if you pass the bill that helps. If you do something wrong tomorrow, I have to hold you accountable. So we have invited them, but they don't want to, because we call them out. When we told the mayor, we were like, your policies are wrong. NYC told him in his face, your rhetoric, you need to stop it. Did he stop? No, he kept saying, I'm doing a great job. So it's hard.
You got the work you're doing. Spread it.
Yes,
We will.
So I will
we
say
have to do that.
there are local electeds who will come, right? So the mayor may not be, an ally on all of these things, but often your council member does want to know what's happening in their district. They want to uplift those things. And so, obviously it depends on where you are and who your representatives are, but there are some who will come often to go to the programs, and they have discretionary funding. They have their own small little buckets of funding, and they can throw $5,000 your way. If they see a community program that you're running that's helping the community, they can send it out on their newsletter, right? And let the rest of the neighborhood know what's going on. And they can then, represent you in some of those rooms. So again, it varies depending on who we have. But I think you're correct that there needs to be more engagement on a really direct level. And we do sometimes help people do that. So, you get council members and get their electeds to the programs to actually see, and then we can tie it. Then we can say, here's what we're trying to do. Look how great this program is. Let's make it bigger. Let's make it citywide. Let's make it happen.
Mm-hmm. And sorry to jump in, but a great way to learn more about these sort of initiatives is there's a website called Documented. There's someone who has a t-shirt there that has a lot of news about immigration, both about policy, but about the sort of programs that we see in the city.
Keep up the good work. And it's not a negative, just that you would have to build that in to make your success be known, because there's so much negativity about immigration.
Mm-hmm.
Right.
Do we have any other questions?
There's many.
Should we putting a mic around?
You got to nip the problem in the bud. The local community boards, the only time you hear about these people is when they do not want another shelter in their neighborhood. Okay, I live in Long Island City, Dutch Kills. That's the ground zero for these hotels that have been converted to shelters for families. You don't want a community hotel in your neighborhood. LaGuardia Community College is right up the block. As the lady was saying, that's taxpayer money that's open in that building for the kids. Why don't they keep it open so that, remediation is remediation. You'd be surprised what you can accomplish in a few hours away from your kids, away from a shelter bed, a hotel room. Aviation High School is right up the block. They should have these buildings open to at least 10, 11 o'clock at night so people can get their lives together and within these spaces, you know. Remediation is remediation. The reason I brought it up is because obviously we're talking about women, but Rikers Island is not but a stone's throw away from all I say. That's not by accident. A lot of these young men who are families of these women, they're going to find themselves in a lot of trouble, and it's not fair. You know, let's think outside the box. We should open some buildings so these people can, you know, function.
Sure. Thank you so much. This is very it's true. He's right. Like when I open, and like she just said, they have a bad image about immigrant, and that's the reason they're not gonna do it. We are criminal. We are lazy. We have a bad background. As soon they hear the word immigrant, that's why. So they qualify everybody on the same way, but not all of them. You see, our citizen people very raising this immigrant, very helping them. You know, she's leaving her house every morning. She's fighting for immigrant. You see, it's not all of them, but some people. They really don't care. Like the mayor say, we're doing a good job. Even he's not doing it. But he say, I'm doing a good job. Okay, that's my way, I'm doing it. If you don't like it, they will say, you can just go back. That's why we all easily hear, go back. If you don't like it, go back.
Can I add one other thing? And just thinking about solutions, and in our case, if you saw our budget, you would be stunned. It's very, very small. And our idea is we do not want to reinvent something that somebody else does up the street very well. So we're really close to PATS, that's on the Grand Concourse. We're close to Mary Mitchell Center, Catholic Charities. So a lot of what we do is partnering with organizations that have a system in place for whatever the service is. And that's how we've been able to provide so many opportunities for the women. We're partnering with Fordham University and probably 3 or 4 different departments in different ways. We partner with Rose Hill Psychological Services, Mary Mitchell, Catholic Charities, the Jesuit Scholastics. And so I'm thinking about it, like imagining solutions to this. Like, we can't be silos, right? I mean, we can, but if we're not, I mean, the work that we're doing, right, with the food distribution, it works and it's affordable, and it's building up what PATS does really well, and collaborating and not reinventing something and using resources when we can partner and save that budget stream.
We have time for one last question.
Is this working? Yeah. I was wondering what you think. You've been addressing the shortcomings of policymaking, implementation, etc., and also the solutions you actually bring. And in a way, to me, you are policymakers at your level. You are respondents. It means that. But I was wondering what you think about migrant participation in policy formulation. What does it mean to you? Do you think that would change anything or not? And if yes, because the no could be no because we think it's just tokenism. The yes could be yes, maybe there is an impact. And if yes, how would you do it? And the question is really to all of you. I know it's not an easy question, and I don't need a perfect answer, but I think the people we should be asking, that is really you.
I'm going to respond. So I 100% believe migrant, like I will focus on terms of economic, right? If these millions of people, hundreds of people, get a work authorization, get their background checked, get a job, I promise you, in 6 months, in 1 year, the economy of this country will raise. It don't make sense to spend money, $3,000, $1,000, $1,500, like thousands of dollars, leave these people on the shelter and just say, oh, like they will apply for asylum. And I waited for 6 years, 6 years. And every single day I have to call the district. I will go to Google, and who is the representative of my district, keep sending them email, keep sending them email, keep sending them email. New Jersey, every Friday I was going to New Jersey to get an interview. You think it makes sense? If I have my work permit, of course I will work. I believe that if these people, it's true, we need a housing, that's true. If they get a place to sleep, and the second thing is to get a job, right? They get the work permit as soon as possible. It will be 100% change. Not 100%, but at least 50, 60, 70 going up, it will be a big impact on the economy. And these people, not only on the economy, it can go to the policy making too, right? So I feel like it is just come, we're gonna feed you. I don't think this system is good. Come, involve yourself, put your hand down, help us to work and make this country better. But they're not letting us do this. Why someone can wait 6 years without getting a work permit to work? It don't make sense. And you think you will keep paying the rent for these people? You were doing, leaving them in shelter? I did 4 years in shelter. And every month, it was $3,000. Look at the money they always spend on me. Look at this money. Why not give me paper to go to work? Why not give me work permit to go to work? It don't make sense. It's not about raising the application fee. No, give them no matter if you raise the application fee, whatever you did, give them the work permit to go to work. Give them the work permit. I know a lot of people who's here every day, they cry, women, they want to go to work. They want to go to work. They don't have the possibility. They can't work. And do you think, a couple of weeks ago, they were saying on the news that there was a lot of people doing delivery of books. It's killing the country. It is killing the country because they're working off books. Why not give them paper and this tax we include in the country and the country economy, right? And I think that government have to see in that way, whoever who can, immigration side, they need to do something about it. And immigration can give a big impact, a big positive impact in terms of economy, policy making, and even putting their work to make this country more better. Honestly, I believe that. If these people get work permit to work, give them work permit. If they're criminal, no work permit. If you do background check and they have a past criminal history, no, you put them on the side. But not all of them are criminal. Not all of them. Every day I was going to my caseworker crying, I want to work, I want to work, I want to work, I want to work. And I don't even have paper to work. They are killing the country silently doing this.
And we do know, actually, many of the positive benefits, and as a response to, partially to the other gentleman's statement of making narrative change. Immigrants in New York State contribute about $24.5 billion to state and local taxes, about over $61 billion if you include federal taxes. Undocumented immigrants contribute about $12 billion in taxes. Immigrants are more likely to become entrepreneurs than their peers. They are more likely to do a lot of the things that we really want to see, start businesses, take risks, work hard. They are also, have a positive effect on inflation. Inflation actually drops when you have higher immigration. There are plenty of positive, substantially positive benefits, not only to the immigrants that we welcome, but to the rest of us who are already here when we bring in, immigrants and when we support them once they're here. So,
yep.
I don't want to be a man who has the last word on the panel, so I need to be the last word today. Okay, cool. But I want to add something to some of these things, right? First of all, these are not issues that are unsurmountable. The other day I was at the Canadian consulate. It takes 5 to 10 days for an asylum seeker in Canada to get a work permit.
Jesus.
Right? 5 to 10 days.
You see?
It's no rocket science, right? So we know that it's a question of system, right? Secondly, there was a nice report in the Times a couple of weeks ago explaining why the recovery from the pandemic has been better in the US in comparison to some European countries, largely explaining it through immigration, right? And thirdly, beyond the statistics, I think we need to have some memory in two cases, right? First of all, the discussions we're having here today about the Venezuelans, about the Haitians, about everyone, we have had them 100 years ago about other groups, right? The skepticism has always been there. The newcomer was someone who was not welcome. Then the Jews were not welcome, the Irish were not welcome, the Greeks were not welcome, the Italians were not welcome. They made their own space through their contributions to the economy, to the culture, to everything that the city is today, actually, right? And my final point is that a couple years ago, it might be a little bit more, all of us in all of New York City were in their, fire staircases, balconies, applauding immigrant workers. The essential workers was more than 60 to 70% immigrant workers, right? So I think it's very important to remind these things. I think it's very important to also explain that this is not a story also about being more human and welcoming. It's a story of taking a good care of what creates the city that we're in today, right? Okay.
Thank you so much. And no, I would not let you have last here because I'm here too. So, but I really just can, but only wait yet. Maybe coming. With 3 words: capacity, strength, knowledge. So when you are thinking of women in experience of post-migration, rocking up voice, I think. Brian.
When we are thinking of women with lived experiences of forced migration, that's the words that I hope we take with us: capacity, strength, and promise. But the way to get there is by coming together, by using all our resources, by holding the leadership, any kind of leadership, accountable, because it is not true leadership unless it represents the people. So I do hope we take this with us. Thank you for coming and listening, and thank you to our amazing panelists. Please, let's give them a hand. Thank you. And now, Lara, you want to prepare us for the next panel?
Thank you very much to the panelists of the community talk, also from my end, as the founder and executive director of the Center for Migration, Gender, and Justice, to the organizations sharing their work today. So please go check them out at the Community Resource Fair. Thanks to Dr. Popescu and Dr. Kalergis for leading us through this important discussion. We will take about 5 to 10 minutes to transition into the next panel. So I hope for those of you that are here, we'll stay to talk about gender-based violence in displacement context. Feel free to grab some food, but we will start promptly in about 5 to 7 minutes, okay? So feel free, let's start the transition to the next panel. Thank you.